Welcome back to the channel. If you're a home health nurse, you've probably noticed that documentation is starting to change. More and more, EMR systems are moving towards voice narration and AI-assisted charting. In this video, I want to talk to you about something that most people aren't discussing yet. How home health care nurses should actually structure their thinking before they start speaking. Because here's the truth. AI charting only organizes what you say. If your thinking is organized, your documentation will be organized. Today I'm going to show you the framework I'm personally learning to use during my visits. Across the country, agencies are starting to adopt tools like voice-to-text charting, AI-assisted documentation, and automated visit note generation. Now, on the surface, this sounds great. It promises faster charting and less time spent at night finishing notes. But there's something important nurses need to understand. These systems don't think clinically. They simply organize the words that we speak. So the quality of the note will depend entirely upon how clearly we narrate the visit. Here's the challenge. AI can only document what you say. If your thoughts are scattered, the system will produce a scattered note. And many nurses, especially when they're tired after a long day of visits, tend to narrate something like this. Patient doing okay, wound looks fine, education given. But those types of statements don't clearly demonstrate skilled nursing care. The biggest mistake nurses will make with voice charting is simply talking without structure. They'll narrate whatever comes to mind in the moment, but Medicare documentation needs to tell a clear clinical story. A good visit note should show the patient's condition, your clinical assessment, the skilled intervention, and why continued nursing care is required. Without structure, these pieces get lost. This is the key concept I want you to take away from this video. AI can organize words, but it cannot organize your clinical reasoning. That part still belongs to the nurse. So before you start narrating during a visit, you need a mental framework that guides how you speak about the patient. Here's the simple framework I use to organize my thinking before I start narrating. 7 steps. First, the patient status. Second, your assessment findings. Third, any changes since the last visit. Fourth, your skilled nursing assessment. Fifth, the skilled interventions you performed. Sixth, the patient education. And seventh, the ongoing skilled need. When you follow this structure, your note naturally tells the clinical story. Let me show you the difference. A weak narration might sound like this. Patient doing okay, wound looks fine, education given, but there's a stronger version of that same visit. Patient alert and oriented ×3, wound on left lower leg measuring 2 centimeters with granulation of tissue present, skilled wound care performed per physician's orders, and patient educated on signs of infection. Continued skilled nursing required to monitor wound healing. It's the same visit, but it's completely different note quality. To help nurses practice this framework, I've created a free resource called the Voice Narration Phrase Bank for home health nurses. It includes structured phrases you can use during visits to make your documentation clearer and more organized. You can download it using the link in the video description. My goal with this channel is very simple. After 26 years in nursing and more than a decade in the home health field, I'm learning these new tools just like everyone else. And I want to help other nurses adapt to these changes without feeling overwhelmed. So if you find this content valuable, think about subscribing, and we'll see you on the next video.